Yeah, we have, you've already found that they've had a little sensitivity, we've palpated, we looked around. So as I'm talking, I'm just going to do this. Okay, open your mouth a little bit. And take a look at the tongue. And there's also some stuff that on the tongue that you can look at if you have a fluted tongue, or a fluted tongue often means that they're pushing down or they're abnormal swallowing mechanism. So you just take a quick look. After that, we're pretty much done. As long as there's no loose teeth, no history of hepatitis or AIDS or anything else I need to know. And so I'm going to go in and palpate a few things. I'm going to touch a few things in your mouth. Some of it's going to be sensitive. I'll try to let you know when it is. If you, I won't be in there too long. I don't want you to bite down until I tell you. And if I tell you to bite down, we're just biting down very gently. All right? And if you can stimulate headaches with this fairly easily, so if they want you out of the mouth, like Eric said, get in and out, but if they want you out of the mouth, you can tell them, I just want you to tap your chest, you know, but don't bite, and don't, you know, growl, because that's compression. Okay, whatever. Okay, so what we're going to do first is we're going to be thumb down, and we're going to go thumb down, straight down towards the back molars. All right, and so just relax, and I'm just going to come in, and then I'm just going to relax his jaw, and I'm going to use a key grip. So I'm going to grip around, grab that mandible in the corner and underneath, and then just relax for me. Good. So now I've got a hold of it. Okay, I'm going to stabilize on the head. And the first thing I'm going to do is I'm just going to do a little bit, we're going to look at the articular joint. Oh, sorry, now you're going to get it because I'm going to be talking.
All right.
Okay, so the first thing we're going to do is we're going to come in, grip it, and we're going to just do straight distraction along the plane of the joint, which is this. Look at me for a second. It's this. Traction. Okay, and then we're going to go lateral glide, medial glide, and forward glide. Okay. There we go. There. And we're done. All right. So the trick of it is teeth, angle, mandible, grip, they relax, and you're just moving it all real easy. All right? So that's the articular portion. So then we would check the other side to see how it looks. And it looks like there's
Okay,
something
you
in this.
did traction, side to side, forward and backward, right?
Yeah.
Okay.
Yeah. We got a little difference. You feel that?
Uh-huh.
So if we look at him, he has a little bit of asymmetry, so just how he's moving. And so we should have seen a little deviation with opening. You did?
Yeah.
Okay, so we didn't, yeah. All right, and so the next thing we're going to palpate is, I'm going to have you palpate the inferior head of the lateral pterygoid, and it is always painful. Okay, we can't get to the superior head that's attaching really deep into the joint. But the inferior head is always painful, and so you tell them that it's always painful. And where you want to be, people often don't do this well because they don't like to get into the corners of the cavern. Okay, so we're way here. This TM joint is right way deep in here. Okay, so the muscle will extend itself out to here, but where you want to palpate the muscle is way back in here. So I'm going to palpate it, and if you have any TM problems, this thing is tight. So it's going to be on. It's like the psoas, so it's the protector. And I just want to see how bad it is, and then just relax. So I'm going to stick my finger in. Now I'm going straight back to his ear. Okay, that's not too terrible here, though. So I'm now not on teeth. Okay, I'm in between the teeth and his cheek. My thumb is pointing laterally, and I'm on the tip of that muscle right here. So if I was on the outside of it, remember I said just open just a smidge?
He wants to tip.
There's both of them right there. Okay. Let me just feel what the floor looks like. Just relax. Big difference, huh?
Mm-hmm.
Yeah. Left one's not sore at all. Not sore at all, right?
No, not compared to that right one. That right one.
Yeah, it's not. The right one's still stiff. Okay, so that's a muscle, and that is worth feeling, and it's actually worth feeling if they can stand it, not just the muscle, but just on the, I'm gonna just palpate this side, I'm gonna be right in the way of everybody. Just because this one's not sore. Okay, so there's the muscle, and if I can get it to relax by a little pinch, I can actually come back and feel the front of that joint to feel if it's swollen. Okay, and see that doesn't really, I mean, it's, you feel it.
But it's not.
You feel it. Does it hurt, or do you just feel it?
I don't feel it.
Yeah. So that's really different. I'll just take one quick, and I'll be in and out.
Oh, yeah, baby.
Okay, so I do want to know what the front of that joint. So the pterygoid. So even if I was unclear if my active movements were deviating, that muscle is telling me that the jaw is involved with something, because that's way too different side to side and it's way too painful. Okay, then the last thing we do is we do the ligament stress test. So remember, the lateral ligament is the most important. And so the first thing we'll do is we'll open the mouth, and from here we're going to stabilize the temporal bone, and we're going straight down. So I'm just going straight down like that. So distraction, relax for a second, and then open. Distraction was this. Okay, along the plane of that articular eminence. This is opening, stabilize, straight down. And then the spheno and stylomandibular, those little tiny suspension ligaments, what we're going to do is we're going to come on there and we're going to have them close gently. Good, we're going to grip, and we're going to bring his jaw forward and then straight down. Good, nice and tight on those. Okay. Anything else? Oh, we could do palpation. That's the intraoral assessment. Anything else intraorally?
Did you do the horizontal ligament stress test?
No. I don't think I know that one. Come, pop in. So the other thing that we want to always do is palpate, like, so not, instead of just watching motion, palpate right behind the condyle and palpate the motion, or you can go in the ear and palpate for the TMJ. Now again, you want to be sensitive to being in the ear on some people. I had a PT that I knew that worked with me when I first was out of school, and she had a car accident, and Bev, your friend Karen, went in her ear to palpate her jaw, and she took her hand out and her ear started bleeding because she had a basilar skull fracture. Remember that bleeding right behind the ear? And so she had kind of went to the jaw without looking at everything. So it wasn't that she started the bleeding, but there was a basilar skull fracture. Ever since then, I'm always like a little careful going in the ear, but I'm sure that's just worry now at this point.
So there is another, it's actually a couple bands of a ligament, and that you can call them either the intrinsics or the horizontal ligaments, and what they do is they help to restrain closing. Okay, so sometimes if we have somebody that has a real bad forward head posture, we can put a little extra tension on those, because essentially what happens is it pulls them into a retruded position, so they put a little extra tension on that. So go ahead and open that for me. And so same grip, basically what I'll have them do is just close down very gently right there, and then my stress is actually straight back.
Okay, so good. So I went forward for the stylomandibular and sphenomandibular in that same position, and then straight back. So,
yeah, so it's just
easy.
here
Forward,
and then
there.
there.
Perfect.
And which ligament is that?
There's a couple names for it, either the horizontal ligaments or the intrinsic ligaments.
It's not painful.
Never heard it called that.
Let's practice.